The topic of the underfunding of public health jurisdictions is decades old.
San Diego County Health Officer Dr. Wilma Wooten says substantial long-term funding has eluded local public health departments, and with the spotlight on the pandemic, now is the time to change that.
Oh, absolutely, now is the opportunity.
The public health department hasn't seen a decrease in funding like some others have, but that's due in large part to a team of grant writers that get state and federal dollars. Health and Human Services Agency Director Nick Mascione says funding from the state and federal government is typically reactive.
When there's a crisis, then funding will flow versus the using our adage in public health prevention, investing the dollars and building the infrastructure. I don't think there's any community across this country that would say they have the adequacy of their public health infrastructure.
At the height of the pandemic, the public health department more than doubled their budget and nearly doubled staffing.
That was just COVID-19. What's on our plate for public health? Everything. Homeless. Getting to zero for HIV and TB and hepatitis. I mean, it's all those things, right? It's malnutrition. It's all those things. And so have we doubled ourselves for all those things? No. So to answer your question, do we need far more resources in public health? Absolutely yes.
Mascione says the pandemic could be the eye-opener for state and federal officials, similar to how the September 11th attacks on the World Trade Center prompted a major shift.
Think about how security and how the airports changed and just the whole nature of the awareness. The pandemic and COVID-19 has done and will do the same for us in this country. And we hope it's for the good.
He says the pandemic revealed gaps in the way people have access to resources.
We're ending a pandemic with COVID-19, but there's another pandemic we've been dealing with, and that's the health inequities. And it is a pandemic, because when you look at, and COVID-19 just put the light on it to see how different parts of our county, different parts of our state, different parts of our nation were living, and some of them were not living well. And it's no surprise when you have overcrowding or people that were not in any type of shelter. It was no surprise when people did not have food security or a job, and therefore, if they were sick, had to go to work or were felt forced to go to work because they had no ability to take care of their family. And those were enablers, unfortunately, of viral spread.
The county made early investments in programs to build trust with communities that they weren't connecting with. They hired promotores, also called community health workers, to get the word out in the Latino communities.
We contract, we put our money where our mouth is, and provided those contracts so that communities would have individuals that looked like them going out and conducting that outreach.
They were a game changer. They became extenders of our nurses.
The state later provided one-time grants for similar outreach programs, but officials want to keep them going long-term, especially if another crisis happens. In general, Mascione says root issues need to be addressed, not just being reactive to situations like the mental health crisis and rising numbers of encampments on San Diego streets.
It's those social determinants. So it's housing. It's helping people with jobs. It is, in fact, that leadership, which is that training of bringing folks forward, right? So those are things that you don't think about in the realm of public health, but if you were to address that, you would really improve the public's health.
Wooten says the public health department needs to maintain a trained workforce and have the right infrastructure to be completely effective and nimble.
So for us in San Diego, it's our registry, our immunization registry, or our surveillance system, and our laboratory systems. So all of those are IT systems that we are looking to improve upon. So that's not a small dollar amount, that's a large dollar ticket.
The pandemic is winding down, but not the public health department. Officials are reallocating resources to address mental health challenges and people living on the streets.
There's other needs that were put on pause, and then other things that are beginning to rise, unfortunately. And so we're, again, where public health goes into action is where the need is immediately shifting those resources there.
Officials from the governor's office say they recognize investments in core public health functions have stayed the same or decreased over the last decade, and they're currently conducting a review to assess the state's public health response. Any gaps would be addressed in the 2022 budget. Matt Hoffman, KPBS News.